Hi guys, so we're going to continue with the urinary system. Previously we discussed the main structures of the nephron, discussing that it's broken down to two main structures, which is renal corpuscle and renal tubules. If you take a look at the renal tubules, we have the proximal convoluted tubules, then you have the descending limb, the ascending limb, the distal convoluted tubules, which eventually empties into the collecting duct. We also have the renal corpuscle, which is the beginning of the nephron, and it is made up of a capillary network, which we refer to it as the glomerulus, and it's surrounded by a double layer capsule, which we refer to it as the glomerular capsule. The combination of both of these structures forms your renal corpuscle. So if you look at the main function of the kidney, it's described as a structure that's responsible for filtration. So to filter, what we're filtering actually is your blood. So you have to have a continuous supply of blood to individual nephrons within the kidney that basically ensures that the blood is circulating into the kidneys and enables your kidneys / nephrons to complete the task of filtration. So for this part, we're going to be focusing on the network of blood vessels that are formed within a kidney that basically supplies each nephron. So if you guys remember, we have the main blood vessel that comes from your left ventricle, which we identified as aorta. As aorta came down into the abdomen, we form a blood vessel referred to as the abdominal cavity. And one of the branches of the abdominal cavity would be your renal artery that enters through the region we refer to as the hilum. So if you continue the renal artery, you notice that it starts to branch right here and then right here, or right here, and then you can see the branching. So this is the main branch, and then you guys get this branch and this branch over here. So the immediate branching of the renal artery is referred to as the segmental artery. And the segmental artery, if you continue it, it's going to go between each of the pyramids. So the branching we see right here is referred to as the interlobal artery. So think about each of these as lobes, each of the pyramids as lobes, and it goes between each of these pyramids, hence the name interlobal artery. Now as you go forward, you see this blood vessel that basically right here that runs between the pyramid and the cortex. This blood vessel that you see both in blue and red, which means arteries and vein, is referred to as the arcuate artery, since we're talking about the arteries right now, which continue to form these tiny branches you see right here. Notice that they are radiating. So think about as this main branch coming up right here, what I'm drawing right now, as the one that are radiating outward. So we refer to these branches you see right here as cortical because they're within the cortex. So cortical radiate artery, or you can call them cortical radial artery. Either one is fine. So if you go a little bit deeper, you see these tiny branches coming off right here. And these tiny branches you see in red are identified as afferent arterial. I'm going to write them down. This is microscopic structure. So they're called afferent arterial. And their job is to provide blood to individual nephrons. So when we're thinking about supplying blood to be filtered to individual nephron, the immediate branch that provides that supply of blood is the afferent arterial, which is a tiny branch coming from the blood vessel called the cortical radiate artery. Now, if I continue afferent arterial, we already talked about this, if you guys remember going back to this picture. In this picture, I just want to show you this concept of what I'm discussing. So notice how it says this is the medulla, this is the cortex. So this is the blood vessel that runs right between this. So this is called the arcuate artery, okay? This branch that you see is directly in the cortical, or sorry, in the cortex, so we call this the cortical radiate artery, which forms this branch right here. You see this one? This one would be referred to as your what? Afferent arterial. Now, afferent arterial actually becomes your what? The tufted up capillary network you see at the center, which we refer to as glomerulus. And then glomerulus eventually comes out of the nephron as the branch you see right here going out. And this branch is referred to as the efferent arterial. Remember, we learned about the afferent and efferent when we talked about the lymph node, right? Afferent brought in the lymph and the efferent took it away. Similar concept applies here. The difference would be that we would get blood instead of lymph. So afferent arterial is bringing blood to the glomerulus, and efferent arterial is taking that blood away from the glomerulus. So continuing with that concept, what happens to the nephrons is that now that you have the efferent artery coming out, you have to have the ability to pick up things from the renal tubules. Basically, when you filter something, you also want to be able to pick things from the filter and return them back to the blood. So for that, you need blood vessels. So if you want to return something back to the blood from the renal tubules, you must have blood vessels around the renal tubules. And what those blood vessels are called are either referred to as the peritubular capillaries. You see right here, peritubular capillaries, basically capillaries that are wrapped around the tubules. Or I can refer to them, and I'm sorry I'm going back and forth, but I have to show you something on a picture. So we have peritubular capillaries, what you see in purple, or I can have a specific type of capillaries which is similar in function to peritubular capillaries, but structurally they seem different. So if you compare the purple lines here versus here, there is a difference, but they also refer to as vesa recta. So what I've described to you guys so far, if you look at it in a sense of blood vessels, you started with aorta, which empties into the kidney through renal arteries, which branches to segmental artery, right? Then goes between the pyramids as interlobal artery, then goes between the cortex and medulla as the arcuate artery, and then it starts to branch or radiate inside the cortex as cortical radiate artery. Cortical radiate artery started to form smaller branches for each nephron called the afferent arterial, which eventually become the glomerulus. And then a glomerulus is going to merge together to form your efferent arterial. Efferent arterial then wraps around the nephron tubular as either peritubular capillaries or vesa recta with the same function. Now notice that now that I have picked up the blood and I'm done, now I need to take that blood out of the kidney and back to the basically your circulation, right? Your heart. So whatever you learned for the names in the artery, you're gonna reverse them for the veins. So notice right here we have cortical radiate artery. So what I have is cortical radiate vein. I have arcuate artery, so I would have arcuate vein. I have interlobal artery, match with interlobal vein. The only difference is the veins do not have that immediate branching, which is the segmental artery. So that is absent here, as you can notice. So we go directly from the interlobar to the renal vein, which empties into the inferior vena cava and eventually returns back to the right side of the heart. Looking and identifying those structures in your kidney model. So you have these blue branches right here, which are going to be your cortical radiate vein, which empties to these branches right here called the arcuate vein, which merge together right here and right here going down as interlobal vein. And then if you continue this, all of them empties into what? Into your renal vein, as you can see right here. And again, renal vein is going to empty into your vena cava, or more specifically, I should say, inferior vena cava. The path of the blood through the kidney and what supplies into the nephron in the sense of microscopic blood vessels versus macroscopic blood vessels is very essential. There are always going to be questions on your exam asking you either to identify what is the next blood vessel as far as the branching of the blood vessels, or asking you to write down the pathway of blood through your kidney. I'm going to finish this PowerPoint by going over the two types of nephrons that are present inside your body, and then based on that we're going to categorize the peritubular and vasa recta to each of these classes of nephron. Now, the first and most common type of nephrons we have are referred to as the cortical nephron. Just by looking at this name, it should imply that these nephrons are going to have majority of their structure inside the cortex. So 85% of the nephrons you have are identified as cortical nephron. They're the ones responsible for your typical urine production. And I'm going to show you the picture right here. So notice this is your arcuate arteries and vein right here, which means this is the medulla, this is the cortex. And you notice that majority of the nephron, except part of the loop, is located within the cortex. Therefore, we refer to this as cortical nephron. One of the main characteristics of this nephron is that it has a relatively short nephron loop, which means this really doesn't have much time for reabsorption. On the other hand, you have the second category of the nephron. They are not very common, as they're about 15% of the total nephron numbers. But what you notice about them, if you do compare them, they have a much longer nephron loop, which dips significantly into the medulla, and they're more specifically located at the junction of the cortex and medulla. So these type of nephrons you see right here are called the juxtamedullary nephron, as a junction of the medulla. These nephrons, the juxtamedullary nephrons, are extremely important for production of concentrated urine when your body is limited with water, or it has a limitation on water, or you're dehydrated. Juxtamedullary nephrons are responsible for creating a very concentrated urine. Now, going back to the two types of capillaries that I mentioned earlier, present around your nephron tubules. If you notice, these blood vessels around this capillary network around the nephron tubules or around your cortical nephron is referred to as the peritubular capillaries, while the network of capillaries around the juxtamedullary nephron are much more structured and they're referred to as vasa recta, and they're extremely important in ensuring the formation of that concentrated urine I mentioned earlier. Quickly going over this, vasa recta are part of the urine, extremely important for concentration of the urine. They descend significantly into the medulla, as we noticed earlier, and basically are only associated with juxtamedullary nephron. Peritubular capillary, as I mentioned, they are associated with a cortical nephron, even though it's not written here. They're extremely important for the process of reabsorption and secretion under normal conditions, and basically produce your normal urine if you are removing a balanced amount of water. Okay, guys. So I'm gonna finish up this part of the slide, and then we'll continue in the next PowerPoint.